What a waiting game, and such a significant one. Everybody waiting to see whether the FDA is going to grant emergency use authorization to Pfizer for its COVID-19 vaccine.
But once that vaccine is approved, the next concern is whether people will take it. Our Paulo Suro spoke to a local woman who explains why. For many Black Americans, the concern is rooted in history.
Dr. Kimberly Carr says there's a reason why there's been some distrust towards the vaccine, especially in the African-American community. It all comes back to the infamous U.S. Public Health Service syphilis study at Tuskegee.
I would hope there would be increased participation among everyone. But I also understand that when you talk about vaccinations and you talk about public trust, the first thing that you think about is the syphilis study.
According to the CDC, the Public Health Service, along with the Tuskegee Institute, unethically conducted a 40-year syphilis study back in 1932 on 600 Black men. 399 had syphilis and 201 of them did not. Dr. Carr's great-great-grandfather from her mother's side was part of the 399.
He was syphilitic, right? He was a part of that group, but he began to shrink, right? Because of the stigma of this disease. But my grandmother took care of him all the way until, he passed. There was no informed consent. The scientists did not even keep record of who became syphilitic or what arms. They only cared about the bodies of those men. Those men were more valuable dead than they were alive.
Dr. Carr, who works for the Georgia Rural Health Innovation Center, says there's been a long history of mistrust between African Americans and the medical community. According to a recent Pew Research survey, 61% of white people and 63% of Hispanics said they would get the vaccine, compared to 42% of African Americans. Asian Americans stand at 83%. Dr. Carr says this is no surprise, especially when looking back at the syphilis study.
Blacks are just as willing to participate, but they're just as skeptical, and it makes sense.
COVID-19 has also disproportionately affected people of color. Coming up at 6, we look into that and whether or not Dr. Carr thinks she'll take the vaccine when the time comes.